Just last week, the United States Supreme Court overturned Roe v. Wade, which means 50 years of federal abortion rights ended. Abortion was decriminalized in Canada, though, in 1988. So there is no criminal law telling us how or when abortion can be offered. But even though it's considered a healthcare service, access continues to be a major issue in this country.
Dr. Julie Thorne is an obstetrician, gynecologist, and advocate for abortion care, and she joins us today to discuss the pressing issues around abortion services right here in Canada. Thanks for being here, Dr. Julie Thorne.
Thank you for having me.
So with the recent decision coming out of the U.S., a lot of Canadians I know are asking whether or not the same thing could happen in our own country. Is that a fair concern, or are there different questions that we should be asking as Canadians right now?
You know, I really think that this will not happen here. The majority of Canadians actually support access to abortion care, and those who don't really are in the minority. Instead of asking, will this happen to us here, what I think we should be asking is, how can we assure safe, equitable access to abortion here in Canada?
You know, it's Canada Day weekend coming up, and, you know, we do like to raise our flag and be all proud, but the thing is, some people might not know that in the 2016, the UN actually called out our country for its failure to ensure equitable access to abortion. So who is most affected by access issues in this country?
So I first of all think about our issue of geography, and that's true for a lot in the healthcare system, but we are a big country with a small population and big distances to urban centers, and abortion care is not easily accessible outside of urban centers. The data shows that people who are young and people who are poor are a lot more likely to seek abortion care, so then you add that challenge of distance, and it's extra hard to actually seek abortion care. I want to also create a bit of space to talk about the groups who already feel challenged in accessing the medical care system and don't feel safe in accessing the medical care system. And that includes, and then I guess I should say, if you add sex and you add abortion, which is already a bit of a stigmatized topic, it becomes extra hard to access the medical care system. And so that can include people of color, people who are Indigenous, people who are undocumented, people who don't speak English as their first language, trans and non-binary people. And then if I were to kind of make a third category that overlaps with these, it's people who are victims of or survivors of gender-based violence or intimate partner violence, and they can have particularly hard times in accessing abortion care.
I want to dig into this lack of abortion access in rural areas of Canada. We're going to bring up a map here with data from Action Canada, which actually shows the number of rural abortion providers by province. So you can clearly see that Alberta, Manitoba, New Brunswick, Northwest Territories, Prince Edward Island, Saskatchewan, and the Yukon, there are 0 rural abortion providers. So for people seeking abortion care in those areas, walk us through what that might look like.
I mean, this is so hard. So if they don't qualify for a virtual medical abortion, they have to actually travel to a clinic. And so that can involve finding the clinic that will take them, making an appointment, booking the time off work, booking a place to stay overnight, booking their childcare. Then they have to get their bus tickets or their gas or their plane ticket to get where they need to go. It's a bit of a logistical and financial nightmare. And so that's some of the challenges that people will face when they have to travel.
Now, you provide abortion services directly, and you've met a lot of people who have traveled a long way to get the care that they need. What have you learned from those interactions?
I mean, I've met people from all walks of life, and I might share a couple stories. My favorite stories are when I think about the young people, the 17-year-old who has a good relationship with their parents, who drive them to their abortion and take them to the pharmacy and talk to them about safe sexual practices. I really kind of love those stories. I also think about the 33-year-old who has 3 kids at home, who is already struggling to make ends meet, can't afford her contraception, and then trying to add that extra element of travel makes this like a really big logistical nightmare. And I think about the women that I see or the people that I see whose religion might prohibit abortion, but they have health issues or something that makes this really important, where they're worrying about their ability to care for the family they already have. And if you add that element of needing to keep the abortion secret and to travel for their care, it's just really, really hard. Speaking about abortion draws a lot of emotions, right, for a lot of different people. And I think it's by sharing these stories that we can try to understand why it matters for everyone.
Thank you for sharing those, because it's true. This does, stir up a lot of emotion, but this is humanizing this for us. So let's talk about a big issue when it comes to access. It's the access to accurate information. So people often go online for abortion resources, and the top searches will often be crisis pregnancy centers. I'm not sure if everyone understands what this is all about. Can you explain what they are?
Yeah, so crisis pregnancy centers are privately run organizations that often pay to be the top links that come up on, say, a Google search, and they are intent on directing people away from abortion care. So someone will go online, see this link, they'll click on it, and there might be some really comforting words like, I'm pregnant and don't know what to do, we can help. And so then they go get a consult with them, but their counseling is all around pointing them away from access to safe abortion. And so it really is an intentional deceit.
So I'd like to point out now that there are more crisis pregnancy centers than abortion providers in this country. In Ontario, there are 77 crisis pregnancy centers and 38 abortion providers. In Alberta, there are 21 crisis centers and 5 abortion providers. Nova Scotia has 11 crisis centers and 6 abortion providers. That's just to list only a few provinces. So what are some better resources that you would suggest for people looking to educate themselves on their options?
So a great website people can go to is choiceconnect.ca. You put in a little bit of health information, and they'll actually populate publicly available abortion centers that will provide pregnancy options and abortion care and give you the distance to travel to them based on where you're located. 2 great organizations in this country. One is the National Federation for Abortion Canada, and they are a place that has some resources for healthcare providers, actually, but also information for people seeking abortion care, and a hotline and a fund that can help navigate the healthcare system. Action Canada for Sexual Health and Rights is another one. They're a largely advocacy-based organization, but they also have great sexual health information, have a hotline that you can access, and they also have some fund and some logistical management that they can provide for people seeking this care.
Let's talk about virtual abortion care for a minute. As of 2017, what's commonly known as the abortion pill, it was made available to Canadians. This is a pill that people can take in the comfort of their own home. So how has this option simplified or improved access?
I mean, it's exactly what you said. So number one, they can schedule their own abortion and take it in the location of their own choosing. What has become really great is, and I'm not going to call the COVID-19 pandemic great, but it provided us a bit of an opportunity to accelerate virtual care. And so now you can have an online or phone-based pregnancy options assessment, medical abortion assessment, and then maybe get the prescription sent to your local pharmacy or sent to you in the mail. And so you don't actually have to travel to a clinic to get this care.
I think many patients don't even realize that these options may be available to them. So what do you really wish more patients knew, something that you would want anyone seeking abortion services in Canada to know and remember?
Number one, that abortion is safe and legal in Canada. And number two, not everybody has a primary care provider, but you don't need a referral in order to get access to an abortion. So if you use those resources that I've listed, it can help you navigate your own way to get access to care.
And what would you say to those who either don't feel invested in this issue or think it isn't their battle to fight?
I mean, sexual and reproductive health care is everybody's issue, and abortion is part of that. And whether you know it or not, 50% of people who have a uterus have had an abortion in the past. And if we think of ourselves as a community that wants to care for each other and ensure that our family and friends and loved ones have physically and emotionally safe access to care, then you need to care about abortion access. And so I think if people who aren't invested in this just maybe spoke a little in an open and accepting way with the people around them about this issue, they might be able to understand a little bit more about how it impacts us all.
Dr. Thorne, thank you so much for joining us for this important conversation.
Thank you. Thanks so much for having me.